Welcome, everyone, to the first installment of the DELAhealth podcast. This is the new podcast from the Delaware Division of Public Health. My name is Alyssa Imprescia.
I am Sean Dooley.
And I'm producer Cassie.
Together, we will be joining you here on your favorite streaming service where podcasts are found to give you some information about public health. Delaware Division of Public Health's mission is to protect and promote the health of all people in Delaware. And its vision is to have healthy people in healthy communities. Our goal here is to further that mission by bringing health information to the people where they're at, which a lot of you are here listening to this podcast now.
And public health is looking at things from a larger scale. Everything is somehow public health related, from drinking water to animals to getting your vaccines. Everything has a public health element to it.
Yes, and really, we want to be looking farther than just at the individual health level. So that's really what a lot of this information is going to be. We really want to meet people where they're at. And that means from a health equity standpoint, we don't just want to be putting out print flyers. We're bringing ourselves into a digital space where we can really join the conversation and not only be in an analog, but a digital space for this information.
And as we get deeper into the digital age, it's a great way to reach new people. I'm sure a lot of people watching who are not familiar with what we do here at Public Health and maybe never would have gotten the opportunity to hear what we do without this podcast. So this is a very exciting day.
It is. So some of the things that we're going to talk about in season 1, we have a few guests already lined up. You'll notice our clothing is probably not going to change for the first few for that reason if you're watching us rather than only listening. So we're going to be talking to Deputy Director of the Office of Animal Welfare, as well as one of our epidemiologists that specializes in vector-borne diseases, which are insect and bug-related diseases for the most part. We also have Sean going to be doing a health break, which he will get into in a moment. And we're going to have some Ask the Expert questions, as well as some day in the life segments that you may see as well throughout the season.
Yeah, so speaking of the DELAhealth news break, we'll be transitioning our online newsletter to a video format. So we had the Delaware Bulletin, and now we're going to be doing that on video. You'll get the same information, but it'll just be consumed a little bit differently.
Yeah, so a nice quick snippet of information each month, at least to start. It'll be a monthly little minute that we will add into our podcast and make available separately as well.
So one of our goals with this podcast is to inform the public about public health, because before I worked here, I'll be honest, before the pandemic, I never really heard or thought about public health and didn't realize everything that we do here, that public health does. There's a lot of really great programs and initiatives and services to Delawareans that I had no idea about. And so that's one of our goals with this podcast, is to help spread that information about the awesome things that public health does, all the different programs, to help Delawareans and to keep them informed about, emerging health issues and, any other kind of topical health things that are kind of going around where you might hear people whispering about, what's going on with that? Do you know anything about that? We want to be a source to, provide factual information that you can trust. And, because there's a lot of misinformation and disinformation on the internet, as we know. We're hoping to be a good source for you to stay informed.
Yeah, and I think you made some really great points. I was in marketing and sales prior to this. So one thing I heard in my training to have this job is that public health is working when you don't realize it, really. And even when you do hear about a public health issue, it's usually because it is coming to the forefront and we're dealing with it. And maybe not us, but our experts behind the scenes. A lot of what public health does, like you mentioned, is education and prevention. And that's one of the reasons that we want to have the podcast, to kind of get ahead of things. Information and knowledge is power. We want people to have those tools to be able to be successful, to be healthy, and live better lives.
Yeah, and like Cassie said, there are so many things that people, I don't think, realize falls under public health, such as the Office of Animal Welfare and the Office of Preparedness. those are two things you might not think that those are public health related, but as we said earlier, everything is. And there's a lot going on here that I don't think people are aware of that we can hopefully shed some light on and educate folks about.
Yeah, animal welfare is one that you mentioned. I know we also have a whole section that deals with health promotion and disease prevention. So that is not just tobacco that you probably have heard of. There's also cancer prevention. There is self-management programs for diabetes and other chronic diseases. There are data research sections. I know they do the URBIS and BURFIS every year, which is the Youth Risk Behavior Survey and the Behavior Risk Factor Survey, which is adult and child surveys to kind of gauge where people are at in Delaware at any given year. And they're both done biannually, I believe. So that's some sections that through our communication office, I work with pretty closely. Sean, if you want to talk about some of yours.
Yeah, so we also have lead prevention. Our Office of Food Safety inspects the restaurants and all of the vendors for the state fair or any other kind of festival that happens in Delaware. We have also falling under the Health Systems Protection body art establishments who go in, make sure that all of the body art establishments are clean and sterile.
We have family health services, which not only benefits the education and programs for mothers and children, but also into adolescents. It has reproductive health services as well. And we have epidemiologists that reach out to different people when there is a problem, when there is a disease that comes up, as well as working behind the scenes to try to track and prevent diseases from happening in the future.
Also falling under DPH, you have all of your vaccinations, your vital stats for birth and death records.
So many things, and probably so many more that even in our communications office, we're not mentioning right now. That's just a little taste of all of the programs that we have here. And they do so much good work for people in Delaware. We want to highlight them, and we really want to not only give you the information and the resources, but to honor the people that do this hard work every day. So with that said, we have our first episode of the podcast here. Thank you so much for joining us, for getting to know us. And I hope that you'll join us on this journey through public health education as we go through season 1 and talk about so many topics.
If you have a question for one of our experts or a topic that you'd like us to cover, make sure that you follow us on social media on Facebook and Instagram. Our handle is DE Public Health. And we'll be posting stories where you can respond to us and ask us your question or tell us what you would like to hear on upcoming episode.
Thank you for listening, and we hope to have you tune in to all of our episodes. So join us then.
Thank you very much.